Good morning. Welcome to 10 a.m. Tea with Natalie on this fabulous Tuesday morning. And today I'm checking in to talk to you guys about insomnia. And ironically enough, last night I was awake at 3 o'clock in the morning until about 5 o'clock in the morning for no good reason at all. There's kind of this phenomenon that happens when you are in med school, in which, as you're studying a condition, you suddenly are afflicted with symptoms similar, or you become convinced that maybe you have it yourself. And so, maybe that's a little bit of what's going on here. And so, what is insomnia exactly? Do you know? Do you think it's just like not sleeping at all and just being awake for 50 hours straight? Well, that's one way it can present. But really, insomnia is habitual sleeplessness or inability to sleep. And you can really sum it up really simply by just saying, insomnia is when you don't wake rested for whatever reason that may be. Okay. And that could be difficulty falling asleep. That could be difficulty staying asleep. That could be crazy vivid dreams. That could be nightmares and night terrors. These are all things that would be disturbing your sleep. Also, potentially, waking up to go to the bathroom would be another thing that is not considered to be really normal, especially if it's preventing you from feeling rested. You shouldn't be going to the bathroom, really more than once at the most at night. So if that's something that's becoming an issue for you, definitely talk to your favorite provider and figure out what's going on there. There are also underlying causes for insomnia for a lot of patients. And we're going to talk about kind of the differences between the Western and the Eastern and different natural ways that you can go about addressing this kind of for the rest of the week here. So depression can be a cause of insomnia. Just never feeling rested, being very, very low energy. Anxiety would be the other side, where, your mind is just too wired, that tired and wired phenomenon where you're just freaking exhausted, but your brain will not let you rest. In Chinese medicine, we call that the monkey mind. And it can be very, very challenging for a lot of people there, especially if you have a high stress, situation going on in your life and things like that. Medications can also be an issue. So if you think your medication is causing an issue of insomnia, it's very important that you go back to the prescribing physician who told you to take it and ask if there's something else that you could be doing instead. Because suffering with insomnia as a side effect of your medication is really not okay. I mean, you're looking at a very shittiest quality of life just from that piece. So please don't suffer with things that aren't working for you. Always seek, a better solution. Illness and pain are also reasons that people have a difficult time sleeping. So really treating whatever's going on there is going to be really important. If, every time you roll over, you're feeling your shoulder or you're feeling your back, get that treated, get that looked at. Especially if it's only like a 4 out of 10, like why are you suffering with that? That should be relatively easy, to get addressed. Don't wait till things are 8 out of 10 or 9 out of 10 in intensity before you're getting care. Interruption is another problem. So pets and children, noises, the traffic, depending on where you live, that can really be a big issue for a lot of people. So working on controlling the interruption factors is important. Do you need to wear earplugs to sleep? Do you need a noise machine? Do we need to figure out what's going on with the kids so that they can be sleeping more restfully? Because nightmares and night terrors and growing pains are all things that we can help support the children through. There's no reason that y'all have to be awake all night long. This is something that is not brand new. This has been happening to kids for thousands of years. So we have some pretty great treatments for that in Chinese medicine. So please don't suffer. And if you're drinking too much water before bed, and that's causing you to wake up to go to the bathroom a lot, well, clearly change that pattern. And that, it can be insidious if you go to the gym, after dinner, and then you're kind of drinking a lot of water there, trying to stay hydrated. That can lead to a lot of nocturia at night. So just kind of thinking about when you're taking things in is also really important. We also have an issue of nutritional deficiency. And so I'm just going to kind of get into the more Western nutrients today. And then tomorrow we're going to go into some other things. Chinese medicine and herbs and essential oils and stuff like that. So magnesium, vitamin D, calcium, these are 3 really big ones that I see a lot with my patients who are having sleep difficulties. For me personally, getting magnesium on board was kind of a life changer in regards to really feeling like I could sleep like a log. Like just the depth of sleep I had the first time I had magnesium at bedtime was pretty phenomenal. And so I was definitely like, you know, who even cares magnesium? Like, it's not a thing. But I was definitely proven wrong. Vitamin D was another one for me. And so I worked third shift for 5 years or something like that back in my 20s. And so insomnia was definitely something I dealt with a lot then. Had I known some of these things at that point in time, I think my quality of life and my mood would have been much, much different. So just, you know, remember, basic nutrition is really important for normal body functions, and sleep would be a normal body function. So magnesium, vitamin D, vitamin C. Potassium is another really big one. And this would be, you know, bananas, broccoli, avocados, omega-3 fatty acids from your cold water fish are also going to be really helpful. Omega-3s are going to help kind of soothe the brain in a lot of ways. And so a happy brain can rest, and that can be really helpful. Tryptophan is another one. That's the amino acid that you find in turkey meat that makes people sleepy. You can get that as a supplement as well. Tryptophan is also a precursor for serotonin. And if you've been kind of watching and following along here, serotonin is really helpful for your, you know, sense of well-being and feeling competent and ready to take on the world. And it helps us manage stress and, you know, all those. It's kind of a feel-good chemical. So supporting your serotonin through tryptophan is something that is definitely, you know, beneficial in a lot of different ways besides just focusing on your sleep. I do not recommend, however, synthetic hormones for sleep. Melatonin is a hormone secreted by the pineal gland in the brain when it gets dark outside. And it's telling the brain that it's dark outside, so it's time to go to sleep. And synthetic hormones, like, I don't know if you're a woman and you've been on birth control pills, I'm sure that you can reiterate what I'm saying here, and definitely comment if you have experiences below. But for me, when I was on birth control pills, I had serious issues with my mood. I had a bitch switch that would just flip for no reason. I, you know, had a lot of difficulty kind of controlling my feelings. I would get really emotional over things that, you know, weren't a big deal. Synthetic hormones cause a lot of havoc in the body. And melatonin can also be one of those problems. You do not want to overregulate your body's natural regulations patterns. The only time that I really think it's suitable to be taking melatonin is for jet lag. Okay, so you're literally like changing time zones and you need to get back on like a wake sleep cycle. So that would be something that would be very short term. This is not something that I would recommend patients take 5-6 days a week. Okay, there's also going to be really significant grogginess upon waking with this stuff. It's hard to kind of shake it out of your system. So I definitely think that there's better ways to go about things. You can get melatonin naturally in food. Okay, so tart cherries and bananas and walnuts and oats and pineapple would be a better choice to have, you know, kind of more for your after evening or after dinner snack or, you know, your dessert instead of taking a synthetic hormone. And so bananas are good for potassium and for producing melatonin. So that might be a really great, you know, add into your routine to help benefit your sleep. The other thing I'm really not recommending to anyone ever is diphenhydramine. That's the allergy medication, Benadryl, that people take to help promote sleep because it makes you sleepy. Okay. In 2015, Harvard released a study saying that using diphenhydramine over the course of time, so this is something that builds up over time, people that had used it for 3 years or longer had a 54% increase in dementia. 54%! That's huge! That is huge. Seriously, something significant is happening to the brain when you dry it out with diphenhydramine. So, you know, clearly it's going to be causing issues with mental fog and difficulty thinking. This is not something that you want to be taking over the long term. If you are using Benadryl on a regular basis to manage your allergy symptoms also, it's time to go back to your doctor and think about something that's going to be a little less dangerous and a little bit more effective for you, okay? So please, please, please do not take diphenhydramine as a sleep aid, and do not use synthetic hormones. There's other ways to go about it, and we're going to get more into that tomorrow. So hopefully that kind of starts to scratch the surface as far as getting clear about what insomnia is, which is just not being rested when you wake up, and the different causes, and different supplements that you can try. Tomorrow we're going to be back talking about the Eastern causes of insomnia and different ways that we can address it from other angles. Because there's no reason not to do everything all at the same time so that you can get a restful night's sleep. Because if you've ever had issues with insomnia, you know that it's something you want to take care of immediately. So hopefully you found that to be a little bit helpful. We'll check in tomorrow with 10 a.m. tea with Natalie every Monday through Friday at 10 a.m. Pacific time on Facebook. Have an excellent day, and we'll see you tomorrow.